So today's topic of discussion is rhythm of heart. The rhythm of heart is the ventricular depolarization. Ventricular depolarization is the rhythm of heart, and it depends on the pacemaker which is controlling ventricular depolarization. So now first one is sinus rhythm. Here the pacemaker is SA node or sinoatrial node. So SA node will do the discharge and it will depolarize atria followed by ventricle. So ECG will be each P wave that appear due to atrial depolarization followed by QRS that will appear due to ventricular depolarization. Each P will be followed by QRS. Each P is followed by QRS. So according to the rate, the normal rate is 60 to 100 per minute, that is sinus rhythm. Less than 60 is sinus bradycardia. More than 100 is sinus tachycardia. Next one is junctional rhythm. Here the pacemaker is AV node, atrioventricular node, which is present at the junction between SA node and bundle of His. So what will happen here? The AV node will depolarize atria and ventricle simultaneously. So QRS, which is the big component of ECG, will hide P wave. So the ECG will be absent P wave, QRS is normal. As the AV node is discharging at a slower rate, so in this case the heart rate will be around 50 per minute. The ECG will be look like this: the QRS, T wave, the QRS, T wave, the QRS, T wave. There will be no P wave. The next one is ideo or idioventricular rhythm. Here the ventricular depolarization is controlled by pacemaker. Ventricular depolarization is controlled by pacemaker, which present below the bundle of His. So this is the AV node, this is the bundle of His, these are the Purkinje fibers, this is going to the right ventricle, this is going to left ventricle, this is bundle of His. So below this bundle of His, this Purkinje fiber will act as pacemaker. So what will happen here? The pacemaker may be this right ventricular Purkinje fibers or left ventricular Purkinje fibers. So the both ventricle will not depolarize simultaneously, leads to production of white QRS. QRS duration will be more, and as the SA node is discharging normally, so atrial depolarization will occur normally, ventricular depolarization occur on its own. So there will be no relation between P and QRS. The ECG will be look like P wave followed by QRS, T wave followed by QRS. Sometime P wave and QRS will coincide with each other. This leads to an wave at jugular venous pressure that is called cannon wave. And as the ventricle is depolarizing abnormally, so repolarization will occur also abnormally. So as the ventricular depolarization and repolarization occur abnormally, the T wave will be opposite direction of QRS. This T wave will be in opposite direction of QRS, and the ventricular rate will be around 40 per minute, because Purkinje fibers is used to discharge at slower rate. So these are the rhythms of our heart. Thank you.